good morning. My name is Peace, in the maternity ward working at Our Lady of Lords Mutomo Mission Hospital, and I'm here to show you how to prepare for delivery, whether it's a cesarean section or a normal delivery. First step that you need to have is a clean space. You have to have your resuscitator working in pre-warm mode to prepare for the baby, because most of the times when the babies are born, they're adapted to the environment in the uterus, and when they get out, they are at risk of hypothermia. So you should have your resuscitator working well and have all the equipment ready for the reception of the baby. So these are some of the things that you should have when preparing for the delivery. You should have your 2 warm blankets. You should have also all the equipment working well, like suction tubes. You should have all the thermometers. This is a cannula. We usually have a cord clamp, a tape measure for measurements, and the medications that are administered to the baby post-delivery, and a stethoscope.
To add on, for every delivery, you must have a functional ambu bag, including a neonate-sized mask, O2 reservoir bag, and O2 tubing. Also, you need a functional heart rate and SpO2 monitor with charged batteries. Ensure the batteries are charged and functioning. Also, you need a set of neonatal nasal prongs in case the neonate needs supplemental oxygen following delivery. These items are absolutely critical for every delivery.
These are some of the things that you should get ready for delivery. We usually have, again, all the equipment like oxygen concentrators. We usually have suction machines, and you test whether they are working before the delivery. These are oxygen concentrator, and they're usually connected to the ampu bag. So these are oxygen concentrator. You should test whether it's working well. Yes, we see that our oxygen concentrator is working well. This is our suction machine. You see whether it's working well. You connect it to the suction tubes. You connect to your suction tubes, because some of the babies are born while they have aspirated meconium, and you also need your suction tubes for suctioning and make sure the airway is clear. So our suction machine is working perfectly. Post-delivery, you can have your students or else the delivery assistants that is helping you to do some things for the baby. We can have students taking measurements, that is head circumference, baby length, cord clamping, drying the baby, and giving medications post-delivery to the baby, and even giving the Apgasco. Okay, we can have the medications that are administered post-delivery. We can have the chlorhexidine that is administered to the baby on the cord. It looks like this. So if you open, you drop it at the cord of the baby. We also have tetracycline ointment that is administered to the eyes to prevent ophthalmia neonatorum. And then we'll have your vitamin K and a dropper that can be administered. So you break the vial and there's a dropper. You pick from the vial and then to the baby. Guys, that is all about preparing for the delivery. See you in the next video. Thank you.